In the beginning, it was when we first found this, we were actually very unsure about this. But what we have based this on is actually field data. We have done several experiments in the field with field practitioners, so vets handling broodmares in the field. And we have good data showing that if we can get rid of the dormant infections, then first detect them and then get rid of them, then the broodmares actually has a big increase in fertility afterwards. And this is mostly shown with older broodmares or problem mares that have where the owners are unable or have very big difficulties in getting these mares in foal, and where we can see that this type of infection is actually a major reason why they don't get in foal. And when we get rid of that, then many of them will, or vast majority of them will increase in fertility and get in foal soon after. In my belief, it is streptococci that are by far the main problem as a dormant infection. And we have some data on this. What we have seen is that you can also have other bacteria infecting the mares where it may be dormant. We may just hide an underlying dormant infection. So sometimes we actually culture E. coli after having been reactivating or been using this reactivating substance. And then we can maybe clean off the E. coli. And if we then reactivate or use for instance, bActivate once more, then we see a very clear infection with streptococci. So quite often there is maybe a more complex infection immediately, and then when that superficial infection is cleared, then we can actually get to the underlying reason, which is very often a dormant infection in the tissue. And this is, I think, very often overlooked, because most people will tend to think that if we can just clear the immediate and the visual, the infection that we can actually see, then things should be okay. And then my claim is that you need to dig a little bit deeper and make sure that you don't have the underlying reason for having the superficial infection in the first place. This is mares that have experienced problems early on. So if you've had a mare that had aborted, if you've had a mare that had endometritis, so some kind of infection in the reproductive tract, or if you have a mare that have had a fair number of foals, so maybe 3 or 4 foals or more, or a mare that is 12 years or older. These are all risk factors that can where we have seen that they have a much higher risk of having a hidden infection. So I would focus a lot on them and make sure that they actually clean. So I would definitely very early on, if not by the end of the previous season, make sure that you test whether they have this dormant infection, and make sure that they don't have that. If you have a mare that is not sort of within this risk group, I would make sure that I don't do more than 1 or 2 attempts before you actually test whether they have a dormant infection in the breeding season, because otherwise you spend a lot of resources and time trying to get it in foal, and then you may actually end up finding out that it has a dormant infection late in the season, and then you could have figured that out early on. It's done looking at mares that looked empty, looked clean. We've actually tried in a project, we used swabs, we used uterine lavage, and we also used biopsies, all 3 diagnostic methods on the same mares. And they all proved clean with these methods. Sorry?
How many?
We have data from a project with around 25 mares where we have done all this. All 3 diagnostic methods on the same mares, on all mares. And when we then used bActivate on them afterwards, around half of them, if not more, had a fairly heavy infection. So, I mean, to start out with, we actually didn't believe the data or the results we saw, because we simply couldn't comprehend this was the reality.
Yeah.
But since then, we have seen the same picture in several hundred mares afterwards. So it's simply, it is possible to have a clean mare that looks clean at least, and then you actually find a lot of bacteria in the tissue, in the metrial tissue afterwards.